There is a molecule found in chili peppers that significantly reduces chronic lower back pain, not by masking it, not by creating a competing sensation, but by targeting the specific nerve pain mechanism in your lower back at the cellular level, in a way that no standard over-the-counter pain cream can replicate. And the science behind how it does this is so completely misunderstood by almost everyone who tries it that most people quit using it just 3 to 4 days before it starts working. Today I'm explaining everything, the complete mechanism, the exact protocol, and why the moment most people give up is the exact moment they should push through. My name is Dr. Michael Kent. I have spent over 20 years in medicine focused on senior health. Stay with me because this changes how you think about managing lower back pain starting tonight. Before I give you the science, and the science is going to completely change how you think about this, let me tell you about Margaret. Margaret is 67 years old, retired school librarian from Portland. 3 years of chronic lower back pain that had been attributed to facet joint arthropathy and mild lumbar disc degeneration at L4, L5. She had tried physical therapy, 2 epidural steroid injections, and daily ibuprofen that was beginning to affect her stomach lining. Her pain specialist had mentioned capsaicin cream as an option. She bought it, she applied it twice. Both times she stopped after 4 days because the burning at her lower back felt like it was making things worse, and she was certain it was irritating the very tissue she was trying to treat. The cream sat in her bathroom cabinet for 6 months. At a follow-up appointment, her pain specialist finally sat with her long enough to explain one thing that nobody had told her before. She said, "Margaret, the burning you are feeling is not a sign that the cream is harming you. The burning is the exact mechanism through which the cream works. It is not a side effect. The burning is the treatment doing what it is designed to do." Margaret went home that night and started again. By day 6, the burning from the cream had reduced noticeably. By day 9, she slept through the night without being woken by her back, something that had not happened in over a year. By week 4, her pain rating had fallen from a daily 7 out of 10 to a 3. By week 8, she had reduced her ibuprofen use by more than half and was walking 45 minutes every morning. She told her pain specialist afterward, "I tried this twice and gave up both times. If someone had explained the science on day 1, I would have pushed through." Today I am telling you everything Margaret was never told. Drop your age and city in the comments right now. Are you dealing with chronic lower back pain? Tell me below, subscribe and hit the bell. New senior health video every single week. Now let us get into the complete science. Most back pain creams work on the surface. Menthol creates a cooling sensation, camphor creates warmth, methyl salicylate produces a competing sensation that temporarily distracts the nervous system from the underlying pain signal. That is all they do, distract. The moment the cream wears off, the pain returns unchanged because nothing in the underlying biology has been altered. Capsaicin cream works through a completely different mechanism. It does not distract the nervous system. It changes the biology of the pain-transmitting nerve endings in your lower back tissue, specifically the C-fiber nerve endings that are responsible for the chronic burning, aching quality of lower back pain that most seniors describe as their worst symptom. Here is the mechanism in terms that make it completely clear. The nerve endings in the tissue of your lower back, in the muscles, the facet joint capsules, the ligaments, and the disc annulus, contain protein structures called TRPV1 receptors. TRPV1 stands for Transient Receptor Potential Vanilloid 1. These receptors function as pain alarm systems. They are designed to fire when they detect genuine tissue damage, heat above a certain threshold, acidic pH from injured tissue, or specific inflammatory chemicals produced by damaged cells. When they fire, they release a neuropeptide called substance P. Substance P travels to the spinal cord and signals pain is occurring here. The brain registers this signal as the aching, burning, chronic pain of your lower back. Capsaicin, the active compound in chili peppers, binds directly to TRPV1 receptors. It activates them with the same chemical signal as genuine tissue damage. Not because it is causing real damage, but because it is the molecular key that fits the TRPV1 lock. This is why capsaicin applied to your lower back produces a burning sensation. Your TRPV1 receptors are firing as if tissue damage is occurring, even though it is not. Now here is the part that nobody explains, and this is the mechanism that separates capsaicin from every other topical pain product available without a prescription. When capsaicin consistently activates TRPV1 receptors in your lower back tissue, day after day, with regular application, something remarkable happens. The nerve endings deplete their substance P stores. Substance P is stored in small packets inside the C fiber nerve endings. Every capsaicin application triggers a substance P release. The nerve ending replenishes its supply, but slowly. With daily consistent application, the capsaicin is triggering substance P release faster than the nerve ending can replenish it. Gradually, the storage packets empty. And when substance P is depleted, when there is no chemical messenger left to carry the pain signal from the nerve ending to the spinal cord, the chronic pain signal from that nerve ending goes quiet. This depletion process, called desensitization, is the reason capsaicin is the only over-the-counter topical that produces lasting relief rather than temporary distraction. It is not masking the pain, it is removing the chemical infrastructure that the pain signal requires to be transmitted. And this is also why the burning gets worse before it gets better. The burning you experience in the first 5 to 7 days of capsaicin application is not the cream failing. It is substance P being released in large quantities, all of the stored packets firing simultaneously with each application. That burning is the treatment working exactly as designed. The people who push through that phase achieve lasting substance P depletion. The people who stop at day 4, as Margaret did twice, stop just before the stores are completely emptied. They experience all the discomfort and none of the benefit. Now let me be precise about something important. Capsaicin cream for lower back pain works specifically on the nociceptive and neuropathic components of back pain, the burning, aching, chronic background pain that comes from sensitized nerve endings in the lumbar tissue. It is not a treatment for acute inflammatory back pain flares or for the sharp mechanical pain of active disc herniation. It is most effective for the chronic, persistent baseline pain that most seniors with lower back conditions describe as their everyday reality. The pain that is always there, that disrupts sleep, that makes the first hour of every morning the worst part of the day. For this specific pain profile, chronic burning sensitized nerve ending pain in the lower back, capsaicin substance, P depletion mechanism is directly and specifically relevant. Now let me give you the complete protocol, because the protocol is everything. Step 1. Purchase 0.075% capsaicin cream. This concentration is available at most pharmacies, Walmart, CVS, Walgreens, and similar stores for approximately $12 to $18. Common brands include Zostrix HP and Capsaicin HP. The 0.025% concentration is less effective for chronic lower back pain. The 0.075% produces faster substance P depletion. Step 2. Before each capsaicin application, apply a thin layer of 4% lidocaine cream to the lower back area where you will be applying the capsaicin. Wait 30 minutes. This is the protocol modification that changes everything about tolerability. Lidocaine temporarily numbs the TRPV1 receptors and the surrounding tissue, reducing the burning intensity during application without reducing the therapeutic substance P depletion effect. This combination makes the first 2 weeks significantly more tolerable and dramatically increases the probability that you push through to the benefit phase rather than stopping in the discomfort phase. Step 3. Apply a thin, even layer of the 0.075% capsaicin cream to the entire lower back area, covering the region where you experience your chronic pain. Do not apply to broken, irritated, or inflamed skin. Apply twice daily, once in the morning and once before bed, every single day without exception. Consistency is not optional. Substance P depletion requires consistent daily triggering. Skipping applications allows partial replenishment of substance P stores and extends the time to benefit. Step 4. Wash your hands thoroughly with soap and water immediately after every application. Never touch your face, eyes, or any mucous membrane after handling capsaicin. Consider wearing disposable gloves during application. Step 5. Follow the week-by-week expectation framework so that you understand what is happening at each stage and are never surprised into quitting. Week 1. Burning will be significant, in some cases more intense than your baseline back pain. This is expected and normal. This means the TRPV1 receptors are responding and substance P release is occurring. Do not reduce frequency. Do not stop. Week 2. The burning from the cream itself begins to reduce. Your TRPV1 receptors are beginning to desensitize. The storage packets are depleting. Your chronic baseline back pain may begin to quiet. Some patients notice the first real improvement in sleep quality during week 2. Week 3. Cream application produces minimal burning. Substance P stores are substantially depleted. Most patients experience their most significant reduction in chronic back pain during weeks 3 and 4. Week 4 through 8. Maintain twice-daily application for the full 8-week protocol. Research published in the journal Pain on Topical Capsaicin for musculoskeletal pain found that 8 weeks of consistent application produced significantly longer-lasting relief than 4 weeks, with many patients experiencing continued pain reduction for months after stopping the cream as the nerve endings slowly rebuild their substance P stores. If the burning during week 1 is truly unmanageable even with the lidocaine pre-treatment, reduce the amount of capsaicin cream applied rather than the frequency. A smaller amount applied consistently is more therapeutically effective than a full amount applied inconsistently. One additional consideration specifically for seniors with lower back pain. Many seniors applying capsaicin cream to their lower back have difficulty reaching the precise areas where their pain originates, particularly the lumbar region directly above the waist. A long-handled applicator or the assistance of a caregiver can help ensure even, complete coverage of the target area with each application. Incomplete or uneven coverage means some nerve endings in the pain area are receiving less consistent capsaicin exposure, slowing the depletion process and extending the time to benefit. Margaret got her mornings back, her sleep back, her 45-minute walks back, from a cream that had been sitting in her bathroom cabinet for 6 months, waiting for someone to explain why the burning was not a reason to stop. The cream does not fail people. People, without the complete information, stop the cream before it finishes its work. Your lower back nerve endings need 7 to 10 days of consistent capsaicin exposure to fully deplete their substance P stores. The discomfort of those days is not evidence that something is wrong. It is evidence that the mechanism is active and the depletion is in progress. Tonight, go to your pharmacy. Pick up the 0.075% capsaicin cream and the 4% lidocaine cream. Apply the lidocaine first to your lower back. Wait 30 minutes. Apply the capsaicin. Expect the burning. Understand what the burning means, because the burning is substance P leaving your lower back nerve endings. And when it is gone, the chronic pain signal those nerve endings have been generating for months or years goes with it. Before you go, drop your age and city in the comments right now and tell me, have you tried capsaicin cream before and stopped early? Or are you going to try the correct protocol tonight? I read every single comment personally. If this video explained something that nobody else took the time to explain, share it right now with someone dealing with chronic lower back pain. They may have tried this and given up for the same reason Margaret did. Subscribe, hit the bell. New senior health video every single week. I am Dr. Michael Kent. Push through the burning. Your lower back nerve endings are running out of pain signals, and that is exactly what you want. I will see you in the next one. The content in this video is created strictly for educational and informational purposes only. It does not constitute medical advice, diagnosis, or treatment of any kind. Dr. Michael Kent is a fictional educational persona created for informational health content. Chronic lower back pain has many causes, including serious conditions such as fractures, infections, tumors, and nerve compression that require professional medical evaluation. Do not self-diagnose or self-treat based on this video. Capsaicin cream should never be applied to broken, inflamed, or irritated skin. Avoid contact with eyes, face, and mucous membranes. Wash hands thoroughly after every application. Lidocaine cream may cause allergic reactions in some individuals. If you have a known allergy to local anesthetics, consult your physician before use. Do not stop any prescribed pain medication or change your treatment plan based on this video without consulting your prescribing physician. If you experience worsening neurological symptoms, progressive leg weakness, loss of bladder or bowel control, or severe radiating pain, seek emergency medical care immediately. Always consult your doctor before beginning any new topical treatment, especially if managing chronic health conditions or taking prescription medications.